Most uninsured South Carolinians have never heard of this statewide pharmacy, but it's been quietly providing free medications for years. Listen to hear how the program works, how hospital partnerships are catching patients before they fall through the cracks, and how a related nonprofit is supporting mental health of women and girls across the state. You're listening to the PHEC podcast, episode 468. Welcome to the Public Health Epidemiology Conversations podcast, where we have honest conversations with public health professionals who are creating meaningful impact in communities around the world. They know that the field of public health touches everything. I'm your host, Dr. Charlotte Hughes Huntley, and today we're exploring the fascinating journey of our guest and diving into another conversation that bridges different perspectives with the practical wisdom you need to fuel your impact. Greetings, everyone, and thank you for joining me on this episode. My name is Dr. Charlotte Huntley, an epidemiologist and entrepreneur who has spent over 2 decades at the intersection of health, community, and meaningful change. I am also the author of the Public Health Consultant, Expertise, Entrepreneurship, Greater Impact, publishing December 2026 with Johns Hopkins University Press. Through my consulting firm, Dr. C.H. Huntley, LLC, I partner with large nonprofit organizations, government agencies, and tribal nations on strategic planning and implementation, helping organizations turn health information into meaningful action in the communities they serve. A recent focus of our work has been on workforce development, and we approach it in the same way that we approach all of our strategic planning work, by listening deeply, analyzing carefully, and building plans that are actually put into action. The same commitment to real, actionable public health work is what drives every conversation on this podcast, where public health professionals come to share their stories, their expertise, and their contributions. I'm so glad you're here. I'm very excited to introduce you to my guests on this episode. They lead patient services and community outreach for a statewide medication assistance pharmacy serving uninsured South Carolinians. In this conversation, they walk through how the program works, who qualifies, and how community and hospital advocates meet patients exactly where they are, sometimes literally at the local McDonald's to help them complete an application. They also share how their work intersects with maternal mental health and youth support through a related nonprofit. You'll gain a clear picture of how grassroots public health infrastructure fills real gaps in access, and how creative partnerships are reducing barriers to access across an entire state. Stay with us until the end, where I'll tell you how to access exclusive bonus conversation with my guests inside the PHEC podcast community. Let's connect our conversation right now. Are you a public health professional thinking about starting a consulting business or exploring entrepreneurship? Then the Public Health Entrepreneurs podcast is for you. Visit publichealthentrepreneurs.com or search Public Health Entrepreneurs wherever you listen to podcasts. New episodes are released every Thursday. Well, Jessica and Kahlia, welcome to the podcast. How are you doing?
Doing great. We are so excited to be here with you today.
Absolutely. I'm excited to have the conversation. It's been a little while since we first met and planned to record this episode. I'm thrilled to have you here. So let's kick off with some introductions. Why don't we start with you, Kahlia, and then you just take a moment, introduce yourself, tell us a little bit about, who you are and what you do, and then Jessica, have you do the same.
So yes, I am Kahlia Aposhian, and my, day job, I get the honor of serving as Director of Patient Services here at Welvista, specifically with our Medication Assistance Pharmacy program. And so I've been here almost 3 years now. And so absolutely love what I do. And so our patient services team means that I get to support our team that is actually doing the work and boots on the ground. And so we have a team of community advocates, and I'll let Jessica talk about that a little bit more. And we also have some hospital advocates. And so that is our team that really works directly with our clinical teams, community partners, that kind of thing, to really advocate for the medication assistance pharmacy. And then I also get to support our patient services team, and they take all of the phone calls and vetting all of the applications and making sure we're crossing our T's and dotting our I's and kind of keeping us in check so we can keep doing what we're doing every day. And so I love our team and the work that we get to do. And a little bit of background is I'm not originally from South Carolina. So, speaking of Seattle, that's where I moved here from. And so that is where, yeah, where I spent the bulk of my formative years. And so transitioning here has been really great, really eye opening, right? So, a much different environment, much different community needs from every standpoint that you can think of, and even more specifically from a public health standpoint. So, it's been a lot of learning, a lot of connecting, a lot of building communities, a lot of networking. I really love that. And so, outside of that, my passion is reading. I drag Jessica to tons of book clubs with me and house plants, and I have a new love for golf. So,
Oh, that's amazing. Well, that's so much synergy there because I was just telling someone about my adventures in golf. I started playing a little bit and to the point where I convinced myself, okay, I need my own set of golf clubs. I was trying to share with my husband, this is not designed for me. And then he had problems with his shoulders, and so he wasn't able to play for a while. And then I fell off the bandwagon. I really need to pick that back up because I
yes,
really enjoyed it.
I'd be happy to initiate that. Yeah.
Awesome. Well, Jessica, introduce yourself, please.
Yeah, so I am Jessica Gaines. I am the Community Outreach Advocate Manager here at Welvista's Medication Assistance Pharmacy. So, like Kalia said, I work directly with our community outreach advocates across the state. We have 12 that serve multiple counties across South Carolina. So they really are our boots on the ground. They're the ones out there in the communities, meeting directly with patients. They're working with clinics and doctors' offices, other nonprofit organizations, community organizations, and things, just making sure that people know that we exist, making sure that patients understand how our process works, and that they have someone who can actually help guide them through that process. We try to make our application process as simple as we can, but of course, there's always those questions and things. So, making sure we are able to provide that one on one support is really important for us. So, that's what I do, just make sure that they have everything that they need while they're out there to best serve our patients and our partners. Like Kalia said, we both
Mhm.
are book girlies. I love to read. I love thrillers. I'm also a true crime junkie. So that's what I do in my free time. But it really gives us that outlet and that
Mhm.
space because the work that we do can be heavy sometimes and it can be a lot. So being able to make sure that we take time to breathe a little bit and focus on ourselves from time to time. We're not that great at it, but we're working on
Yeah.
it.
I definitely understand. It's so important. I mean, we know it's important. We will tell other people, but it's hardest when we need to do that for ourselves.
Mhm.
Before officially hitting record, I was sharing with you all some of my travels and adventures. And, we took about 3 weeks and intentional time for me to slow down and, which included a very significant stop in Seattle, which is so funny that you're from Seattle. I didn't
Yeah.
even think you shared that story. But yeah, it was difficult for me to slow down. And I think I'm interjecting enough like downtime throughout my regular routine. And I realized that I'm not doing that well enough because it took about 3 days for me to really unwind enough to realize, okay, well, I'm in a vacation mode or slower pace. I'm not only trying to make sure I'm not throwing myself back into that now that I'm back to routine, but I'm also, for me, I have to plan out these next breaks instead of waiting till I feel like I need a break because I realize that's too late at that point. So wonderful, wonderful. I definitely want to hear all about medication assistance pharmacy. I really want to hear all about that program because I think for me, it was so refreshing to hear. It was very innovative. I'm really excited to share a great resource that we have here in South Carolina. But before we get into all that, I always love to ask this question, kind of rolling back time a little bit and seeing how you got here, because you're absolutely representing the work of public health. Do you remember a time when you first became interested or first heard about public health? And I'll let the one of you decide who wants to go first.
So I don't really feel like I went out looking like, oh, I would like to work in public health. It was more so when I started my nonprofit career, it really highlighted the need, the lack of resources, the lack of access. So I kind of feel like public health found me. And it was always important for me to make sure that people had access to the resources they need, especially when it came to their health, because your health affects everything else that goes on in your life. And so I think definitely when I got the job here at Welvista, things really clicked and I was able to see firsthand how many people fall through the cracks of the healthcare system, not because it's not there, the resources are there, but they can't access them, they can't afford them. And so that's kind of when I was like, "Oh, I'm already doing public health. That's what I'm doing." And so that's kinda how my journey is.
Yeah. And mine was a little different. So once I transitioned here and relocated to South Carolina. So this is my first leg, if you will, and experience into nonprofit. But before that, when I was living in Seattle, that was my first huge introduction to public health. So I was working for the University of Washington Medical Center, and I was their assistant director for their patient relations department. And so my team worked really closely with the risk management team. So, in short, when things were not going well, I'm the person you call. And my role came really vital when I was there during COVID. And so that was a major introduction into public health and how vital it is and how detrimental it can be if it's not going well, right? And so there was a stint where, unfortunately, with, so much going on at the same time, collectively, nobody really knowing what was happening, what was true, what we needed to prepare for, what does this mean, all those in between. And University of Washington really being kind of at the forefront of a lot of it, right? And so there was a good year where I was the only person in my role for the two hospitals in Seattle. And so it was a constant conversation with our community members and really talking them through kind of what was happening at the time. And so it was a really close kind of conversation and connection again into public health and what was happening at that time, whether it was, hopefully getting to a more positive end, but then sometimes it was kind of steeped in a lot of fear, a lot of the unknown, and a lot of figuring it out along the way. I'm working with with the medical providers and the teams and medical directors and all the things. And so then transitioning here and getting into the nonprofit space really was kind of not, dare I say, my plan, but the job with the University of Washington admittedly was very taxing. And so I wanted to switch gears and be on the helping end of things. And so having the opportunity to interview and look at an opportunity to work here with Welvista was a game changer for me for sure. And so feeling like I can really take a more proactive approach to a public health instead of waiting until things weren't going well, right? And so that was a really great transition, so to speak, so that we can really work within an organization where we work daily to be at the forefront of preventing crisis and emergency visits and things that our community members have to result to when they don't have access to medications.
Yeah, very important. Well, what is Welvista? And also then what is the MAP, medication assistance pharmacy?
Yes.
Yeah, so Welvista is a nonprofit organization, and we have two different programs. So Kalia and I work for the Medication Assistance Pharmacy. That is a statewide program. I'll talk more about it in just a second. But then we also have another program under the Welvista umbrella called Smiles for a Lifetime. And so that is in certain areas of the state, they are working with pediatric dental care. So they have actual dentist office located on school campuses. They provide transportation for kids in those school districts and everything, just trying to make sure that the kids have access to the dental care that they need. But the Medication Assistance Pharmacy, we are a mail order pharmacy. The pharmacy is located here at our main offices in Columbia, but we serve the whole state of South Carolina. Everything is mailed directly to the patient. We have over 300 medications on our medication list. A lot of it is preventative care, mental health, diabetes, health, heart health, and things like that. The only thing that we do not offer are controlled substances just because they are mailed. But yeah, so we have it's an amazing program. We work with uninsured populations. So make sure that they're able to access the medication. Everything is free of cost. And when you enroll in our program, you're enrolled for a year. But as long as you continue to qualify, you just reapply, and there's no time limit on how long you can be in our program. So we have people who've been in our program for many years. We have some who that is just a little intermission time until they get that new job with access to medical care. So it just depends. There's also no limit on how many prescriptions you can get at a time. So that's really good. And we also offer diabetes testing kits and strips and things like that that people don't think about that also cost a lot of money.
Absolutely.
In addition to those prescription medications, we also do offer over-the-counter medications. So we have, your allergy medicines, vitamins, melatonin, different things like that that people may need that still cost a lot of money. So we also offer that free of charge as well.
Yep. Thank you for sharing about that. This is one of the things I was excited to bring you onto the podcast to share about. This is a wonderful resource for South Carolina that I was really excited to highlight. So maybe Kahlia, you can talk about the MAP program.
Yeah, absolutely. So yeah, it's kind of like what Jessica was mentioning. So at the very beginning, the qualifications for the medication assistance pharmacy is, again, they have to be uninsured, so no insurance coverage at all. And then you also have to be a South Carolina state resident. And then the income qualifications are 300% of the at or below the federal poverty guidelines. And so those are the three qualifications. And so that's where Jessica's team is very instrumental in helping to walk community members through that process. So, we have a very, diverse and collective community. So that if that's a matter of helping the medical team coach or assist a patient with the application process, or sometimes if it's just a matter of meeting a community member at the local McDonald's to help them walk through it, right? Because even something as basic to us as literacy may be a challenge for some of our community members, and we do not want to have that be a barrier. And so however we can meet their needs and meet them where they're at is literally what Jessica's team does. So it's really great hands-on resource there. And then the other part of my team is the hospital advocates. And so they do the same thing, but in a slightly different format. And so we have contracts with some of the local hospitals that basically allows us to put one of our advocates in that hospital, and they're there in the hospital 5 days a week. And so they work directly with the care teams and social workers to meet directly with patients that are there in the hospital for, a multitude of reasons, but do not have insurance. And so our advocate will work directly with them or a loved one, a family member, whatever that looks like, to get them on our program so that they have their medications in hand by the time they leave the hospital. And so, as you can imagine, that is incredibly beneficial, not only to the patient, but also to ensure that hopefully the intention is to reduce the amount of readmissions for those same untreated causes, right? So we know that a lot of our uninsured community members, the only time that they're seen at the doctors is through the emergency department. For some people, the emergency department is their primary care. And so working with our advocate and the hospital's care team in the collective effort to get them set up with a medical home, to get them on their medications, and then they can start receiving their medications for free directly to their home after that. So it's a really great program. One of my biggest incentives is to grow our hospital program. I believe we have roughly about close to 80 hospitals across the state, and we're currently only located in 4. So there's a lot of room for growth there, a lot of advocacy that needs to happen, that can happen. And so that's a big goal of ours there, because just the need is there, and it's beneficial from a public health standpoint as well as an economic standpoint as well too.
Yeah, yeah. I think that's fantastic. So I'm learning about all of these not new to me programs here in South Carolina. I do like that there's, the plan to advocate and get in, more grow the hospital connections. I think that's a great, incredible opportunity to even, serve on an even bigger scale. There's some other there's another program or another organization that we talked about, and I'd like for you to briefly introduce it, and then if anyone is interested, we can share in the show notes how to connect with you and learn a bit more. But I would love for you to just mention this other organization and its purpose and just a little bit about that.
Yes, absolutely. So you are talking about a nonprofit organization called Girl Get Up Society. And so Girl Get Up Society exists to ensure that we can provide mental health services and resources to women and girls across the state. And so it starts at age 13, and then we go up from there. There's no, age cutoff. And so we provide a host of services. And so whether a teen and their mom connect with us, or a mom directly, or even just an individual connects with us and wants and would benefit from individual therapy, we provide up to 5 sessions for free. And we are contracted with a host of very talented licensed mental health therapists that are located across the state. And so we can help to facilitate whether it's in person one on one visits or virtual. And then we also have a host of workshops and programs that we offer throughout the year as well. And so we have our Girl Power program, which is our monthly teen program that we have religiously, because these girls look forward to this workshop. And so, as you can imagine, with teen girls, the initial first, kind of visit is their mom dropping them off and trying to convince them that they're going to have fun. It's going to be great. There's a lot of mood and feedback and opinions happening. But then once they get through that first workshop and they realize that our intention is creating a safe and open environment for them to not only talk with a therapist that will have group sessions that will focus on self-care, autonomy, healthy relationships, anger management. Like, there's a host of different topics that the therapist will offer once that during that month. But then it also gets them in connection with other girls around that same age that are dealing with a lot of the same things, right? So it gets them out of their normal environment. And with all due respect to the girls, the moms and parents are not allowed to sit in the sessions, right? That defeats the purpose of having a safe and private environment for them to share at will and be vulnerable and be blatantly honest about whatever they're going through or what those challenges are. And now it's become a thing to where they look forward to it. Like, we have a group of girls that they are there every month, like on the clock. And if the schedule changes, we will get a phone call about it. So they look forward to it. And we also change things up so that, in addition to providing that one-on-one like support, but then every quarter we also schedule something fun to take the girls to do. So this past weekend, we took them to Charleston for the weekend, and we were out by the lake and outdoors, and we got to do different activities, make facial scrubs, there was a lot of karaoke and dance competitions happening. But then we also had some therapists that were there to also do workshops through that weekend as well. We went to the International African American Museum. So we try to incorporate some learning and different opportunities that they don't usually get to be exposed to. We went to Top Golf, that was our previous one. So we're always looking at ways to kind of switch that up. But then we also do workshops that cater to our women, right? And so last year we had a mommy staycation, which we are hoping to revisit this year as well too. And so it's one weekend where we had women that signed up, and I think we did about 25 women, and specifically for women that were dealing with either postpartum depression or infant death. And so we kind of collectively got them together and just pampered them the entire weekend. Hotel, food, accommodations, every need was met. If there was a transportation issue, no problem. We're coming to get you. Where's the Uber going? Like, we made sure that they were there and could be doted on. And again, we had mental health therapists that were there. We had spa sessions, a nice dinner. They got to go out on the town for the evening, like literally just being able to be in community with other women that know exactly what they're going through. Also with the mental health therapist to provide some active resources and support to help them once they left the weekend's festivities. And so just building that community. And so I really, really, really love the work that we do. I get to serve as chair on the board for Girl Get Up Society, and Jessica can share about it as well. And so she gets to serve as the secretary, and it's a working board because we have no full-time staff. But I genuinely love what we do. It was a no-brainer for me to get connected with that program because growing up, my dad was a mental health therapist. And so that was a daily conversation in our household. And I didn't realize how not normal that is. And so getting older and realizing that that's not accessible to most of us, right? And so being on the forefront of doing whatever I can to make that a viable, attainable, regular resource for women across the state was a no-brainer.
Thank you both for sharing so generously about these amazing programs across South Carolina. I'm going to let everyone know how to connect with you in both of these organizations here shortly, but I wanted to make sure I know we've kind of at the clock in terms of time, but thank you for being here. I really appreciate you both.
Yeah, thank you so much. And that was a little long-winded, but I get super excited.
No, that's awesome.
Yeah.
I really hope you enjoyed that conversation as much as we did. This conversation shows what public health looks like when access becomes the priority. My guest's work proves that meeting people where they are, whether that's a hospital bed, a parking lot, or a quarterly retreat for new mothers, creates real measurable change. Their story highlights how community trust, persistent advocacy, and creative problem solving turn good intentions into lasting infrastructure. Whether you are in whatever phase of your public health career, I hope this episode reminds you that practical, compassionate solutions are being built every day, often by people who saw a gap and decided to fill it. I encourage you to connect with Kahlia and Jessica and learn more about the great work that they're doing. You can find the links to connect with them on the show notes page. The show notes page for this episode, which is episode 468, can be found at phecpodcast.com. Once you're there, just navigate to episode 468 to find all of the links in the show notes. One more thing before we go. After we stopped recording, Kahlia had to leave for another meeting, but I asked Jessica one more question. The insightful answer is waiting for you inside the PHEC podcast community. It's in our episode activation lab, and you'll find it in a post titled After the Mic. Remember that our podcast has an app and private community. It's independent of social media platforms, and it's a place where you can engage with public health professionals around the world. In addition to being a part of this amazing community, your membership supports the production of this podcast and episodes just like this one. You can download our PHEC podcast community app in your mobile app store, and it is available for both Apple and Android users. Also, you can visit the phecpodcastcommunity.com website to join the community on desktop. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening. The show notes page is where you'll find links to everything we discussed in this episode. To find the show notes for all of our podcast episodes, just visit phecpodcast.com.